£5 billion of the NHS £100 billion budget is going to organisations called clinical commissioning groups, or CCGs. They're made up of GPs, but there's also representatives from nursing, the public and hospital doctors. Their job is to try to improve the health of their bit of the population. How do they do that? Well, part of the way they do it is by commissioning, choosing and buying, services for their population. They can commission services from a range of different organisations, including hospitals, community health services and the private and voluntary sectors. All of these have to be registered with the healthcare regulators, the Care Quality Commission and Monitor. So in CCGs, we've got people who are largely medical professionals who may have had some experience of commissioning, but they need quite a lot of support to fulfil this role. There's two different bodies that support them. The first one is commissioning support units. There's about 20 of these. They're set up to provide technical support to CCGs. They crunch data, they can do contract negotiations and some technical contract management. They're there as a resource for CCGs to draw on if they want to. Another body that provides support is clinical senates. When Lansley issued his vision to give all the money to GPs, there was an outcry in various areas, including from hospital doctors, saying, actually, the complexity of some of our patients is far beyond the knowledge of GPs, so it's going to be difficult for them to commission services they don't really understand. So the idea of clinical senates is to bring together a whole range of medical professions to offer advice to CCGs on particular patient groups or conditions. For example, if you're a CCG trying to commission services for people with heart disease, you might want to get the view of a cardiologist. Well, you can go to a clinical senate for that. They're there to offer advice. CCGs don't have to listen to it. So we've got this collection of around 200 CCGs in England commissioning services locally. But the NHS is a national system and is really high in the minds of the electorate, so there needs to be something that looks at the system from a wider perspective. So we've got an organisation called NHS England. It was originally conceived as a small and lithe organisation. If anyone's got problems sleeping, I'd recommend that rather than counting sheep, they list off all the activities that this small and lithe organisation is going to undertake. You'll find that it stretches to a number of pages. What's NHS England there to do? It's there to do specialist commissioning. So it buys services for conditions that affect a relatively small number of people. To make sure that there's access across the country to these services, it makes sense to commission them regionally or nationally. NHS England also commissions GP services. CCGs don't do this because that would mean commissioning services from themselves, which would make for some interesting contract negotiations, although they do have some responsibility for improving the quality of primary care. There's more than 4,000 people who are employed by NHS England. Some of them are at a central office in Leeds, and we've got 4 regional offices too, as well as around 25 area teams who are playing the NHS England role at a local level. So the original plan was to have a devolved system, but a lot of power will actually be held centrally by NHS England. Another part of the vision was that politicians should be less able to interfere in the day-to-day running of the NHS. The laws changed to give the Secretary of State a lot less power to get involved, although most people are quite cynical about how much this will happen.